see so many clients come in that have made investments that they wish they didn't or they don't totally understand. And so I feel really strongly that education is the key.
Welcome to Money Talk, serving individual investors and retirees. Welcome back to Money Talk. David Wolf here, as always, with Terry Huber and our special guest, Judy Klymer. 40 years experience in the business of the business we're going to discuss today, which is all about how we should be taking, seniors and others should be taking responsibility as a patient for the drugs we take. There's so much we don't know about this, and Judy, who's joining us, has a degree in medical technology and also a master's in public health. Welcome to the program.
Thank you. It's great being here.
Great to have you, and always good to be with you as well, Terry, as well.
Happy to have Judy here. Excited to hear what she has to say.
Absolutely. So let's dive in. So you have a lot of experience, Judy, in the medical technology industry, in public health. Why did you get interested in this idea of responsibility for the drugs we take?
Well, I worked part-time for the Department of Social Security, and we were doing intake on patients coming in to get on disability. And I noticed that many of the 30 and 40-year-old young people were taking 12 to 13 different types of drugs.
Wow.
And I'm looking at it from the aspect of whether they're going to have a kidney, let alone be able to get back to work, which was most of their goals, and the interaction with drugs. And I think that patients, and I used to blame it on older people because I'm a senior myself, but I think patients don't take responsibility, and they go and a doctor writes a script and they just take it. They don't always know what it's for or how it's going to react.
Yeah.
Yeah, they don't ask questions. They just, if the doctor says to take it, they take it. And I've seen that a lot, working with Medicare clients, that they have baskets full of drugs and they don't even know why they're taking them or how they're interacting. And so that became a concern to me too, and understanding that people need to have more information about it.
And that's what we're all about here on Money Talk. So I have to ask, if you had to say there's a root cause, and it may be a little bit of everything, what's behind the idea that doctors are what I'll call prescribing multiple medications without cross-checking or without a more global understanding of what it means when they do that?
In many ways, medicine has changed. Some ways it has not. When it comes to drugs, there are still representatives of drug companies out there pushing certain drugs with physicians. Physicians don't always have the time to check the research. One of the things that I think is primary is if your doctor puts you on a drug, ask how long the drug has been out. Back a number of years ago, the FDA dropped their regulations for number of studies and number of participants in studies. And so there's a myriad of drugs out there right now that were released on the market for a few years and then taken off because they didn't have enough studies. I brought a list, if you want to post that somewhere.
Oh, yeah.
I brought a list.
We could put it in the show notes for sure so people could cross-reference.
Yeah, of drugs that have been taken off the market. Yeah. And they were tested, but if you're testing with a smaller mean, if you're not testing with a mean of 20, 30,000 people, then you're not going to get a good report. Especially you need to do it over a number of years if you're going to test a drug, which was a requirement years ago. Those requirements have become very lax.
This is a subject that's of vital importance, and I'm imagining that as a patient, there are some actions we can take so that we can become better informed and therefore own, quote unquote, air quotes, own the drugs we take and understand how they interact with each other. But I'm going to toss it to you. I see you've got some notes in front of you, and you probably want to drive this a little bit more than I'm able to from my seat here.
Well, when I was practicing and actually in a practice of medicine, I used to find it much easier to be able to work with patients if they were educated. And I find that many of us today are not educating ourselves on the drugs we're taking or asking the correct questions. So one of the things that I came across, because I read several medical newsletters a month, was a medication checkup. And that's something that we should do. We think about going to the doctors and getting our annual checkup, but we don't go over the drugs that we're taking. And it's not just prescription drugs, it's over-the-counter drugs. Because many of us don't realize that the OTC, the over-the-counter drugs, can have a reaction with the prescriptions. And if our doctors or our caretakers don't know this, we could be causing more or further problems. Or perhaps having a prescription drug not work correctly because it's being counteracted by over-the-counter.
Judy, one of the things you said as we were getting rolling was this idea of 12 medications and that sort of gross example, but I imagine it's true for a lot of particularly seniors as you have conditions and they sort of accumulate over your lifetime. Accumulate over your lifetime. So is it about the number of the drugs, or are there certain classes of drugs that tend to cause destructive interactivity?
It's actually both. First of all, your comment about number of drugs, the average senior is taking at least 5.
Okay.
And that could be an over-the-counter or prescription. So if you're taking that, even some of us, like myself, I've taken vitamin C since Norman Cousins first wrote his book on vitamin C and how good it was.
Right.
But as we get older, we need to look at that and then also look if we've been given prescription drugs, how that vitamin C is going to interact. The same thing with Bs and, gammas and everything else that we get over the counter. And there's a number of drugs that are now over the counter that were not over the counter before.
Yeah.
And that's one of the checkups that we need to know. Like Claritin was originally a prescription drug.
I remember Claritin. I used to take Claritin D, the decongestant enhancement or whatever that was.
And Pepsid, which is an antacid.
Yep.
That used to be. Now these drugs are over the counter and they haven't changed. So we really need to look.
Wow.
We need to look at the interaction and what's going on.
So this chemistry was what I'll call serious as a layman. It was real chemistry. And
exactly.
Now is it the running out of a license that triggers it going to an over-the-counter, or what's the trigger?
Oh, the trigger is what our Congress does and what changes with what the pharmaceutical requirements are. And the pharmaceutical companies are big lobbyists, and so therefore FDA regs have changed over the years and become more lax. Because somebody gets excited about a new drug coming out, they want to get it pushed through, and so they're not requiring the numbers, or the number not only of participants, but the number of years which the study goes on before that drug goes out to the docs.
Okay.
And that's very scary.
A lot of people think that over-the-counter drugs are just safe because they're over-the-counter. I think that's a big misconception.
Yeah, even the name suggested over-the-counter. It's easy to get. It's easy access. And it just creates a psychology of lax.
And now some of our Advantage plans will give you as much as $20 toward the OTC, which is nice for us seniors to get that Medicare Advantage plan. But we may be saying, the latest thing is we need to take D2, and we go out and take D2 or B12 or whatever, and find out later that it's interacting with a drug prescription.
It's interesting, Judy, that you talk about those are vitamins and supplements, and they're not. I don't think of those as drugs, but
they are.
They are very
they
much.
Alter your body.
Yes.
Yeah.
And that's an important thing to highlight is that, you think, I'll just more is more. I recently had a deficiency. I work with a primary care who's wonderful, direct primary care. I just got on the program with her as a result of my interactions with Liberty Health. Mm-hmm. And I've never had someone spend so much time with me with my blood panels and determining everything I'm taking. And yeah, she's awesome. So I've now had an experience, and it happens that vitamin D is one of the things I was shown to be very deficient in. She said it was alarming so she had me megadose. But the point is not me. The point is that there are practitioners out there that will spend the time to go through every drug. And maybe there are questions you need to ask your practitioner. Right?
And the thing that if your practitioner doesn't know, like you may be lucky to have a practitioner that knows about over-the-counter vitamins and things like that. Yeah. But if you were going to a physician that doesn't know, build that relationship with your pharmacist. Because a pharmacist will tell you, they actually, when it comes to drugs, have more training and more background. And it's very important that you can say to them, you might ask your doctor, well, is there a generic for there? And quite often a physician will turn around and say, well, you need to ask the pharmacist. I don't know what the generics are. So build that relationship with your pharmacist, and also only ever use one pharmacy. And because they don't all interact. I lost a niece in her 20s because her husband went to pick up a script at a different pharmacy because she was home. And she had a drug interaction and it was not picked up. One was from a specialist and the other was from a primary, and she didn't know. So it's really important to use the same pharmacy, get to know your pharmacist. There's usually a key one there to know, so that you can ask and get a printout from your physicians of everything. And if your physician is missing that vitamin D,
yes,
make sure it's written down so that you can take that in when you see a specialist and say, this is everything I'm taking.
Do the pharmacists, I know they're trained for this, but do they actually have a database per patient that can show potential, what's the word? Interactions,
right.
Okay.
Yes.
Right.
But some pharmacists don't talk to other pharmacists, so
that's the key there. You want a single point.
You want a single point, correct.
All right, cool. That's so profoundly helpful. It's almost like, the fantasy would be your doctor should have a pharmacist in their office that can be your advocate, but I guess it's not set up to work quite that way. But we can make it more like that by doing what you're suggesting.
We're also very lucky to be living in this area because we have a great pharmaceutical school here.
Oh.
At UNM.
I didn't know that.
Yes, we do.
So here in New Mexico, we have a really powerful program.
Yes.
Not everywhere in the country. Of course, This podcast is widely available. Our core audience is New Mexico, but that's interesting.
Yeah.
All right.
One of the things we wanted to talk about were, it's an article, it's 7 reasons why you might need a medication checkup.
Okay. 7 reasons why you might need
Judy's going to talk about those, and I will too, but the first one on the list is you might need a checkup if you're taking a lot of prescriptions, and Judy can expand upon that. So, which we kind of talked about.
Right. We've touched on this, but if you're taking anywhere from 2 to 5 or more, but even taking 2, and then you decide to do some over-the-counter, all of this should be checked with your physicians. And so you need to have a list. And the best way to do it, and we used to do this for the federal government with the Department of Social Security, is our patients would bring in a bag everything they were taking.
The actual physical bottles, not a list.
Because some people don't know the milligrams or micros or...
This way it's on the label.
So it's on the label, and your person, be it a front office person or a nurse or whoever, a medical assistant, can actually write it down so it gets recorded and placed in your chart.
Perfect.
So that's one of the key things that you need to do.
Mm-hmm.
Yeah. And the second one is if you're experiencing any kind of side effects, that kind of brings up a red flag. So, Judy, you want to talk about that a little bit?
Side effects are very interesting because when you get your script, a regular prescription, it'll have that 600-page warning about all the side effects. So what you might want to do when you get a new RX from your doctor is say, what's the main side effect here? What's the second biggest side effect you're seeing? Those are the 2 to be aware of. But the other thing, as a patient, you yourself need to be aware of changes. Like we get a fever, we go to urgent care. But if we find we're sleeping a little longer or we don't have the energy we used to have, it could be related. It could be a subtle side effect from a drug. So that's real important for us to be aware of our bodies. And as I mentioned earlier, if we take responsibility, it makes our physician, our medical crew, it makes it easier for them.
It's true that, we've talked about this on prior programs. There's a tendency for us consumers to sort of look up to our practitioners, look up to our doctors as though they're the authorities and they have all the answers, and there's almost a reluctancy to ask any questions out of fear that you may insult them, or you may, depending on the personalities, of course. But that's one thing we really want to cut through on this program, and this further cuts through that, is this idea that you've got to be your own advocate.
40 years of medicine, I've yet to see a physician walk on water.
Exactly.
Yeah, that's true. And also to add to that is the doctors really don't give you that time. When you go to see a doctor, they don't talk about it. They don't give you that time. They're in, they see you, they're out. You don't have even time to ask those questions.
Right.
Really.
The profound contrast. Again, I have to mention my own direct primary care. There's nobody ever waiting. I walk right in. She's ready for me. It's an unbelievable. I need to tell you about her. Her name is Catherine Devine, just so you know, and I'll be happy to share that information. She's growing a practice. It's small, and she wants to grow it to a certain level where she knows she can take care of everybody.
Yeah, and I've gone to her too because
good. So you did go.
She did the whole blood panel workup.
I don't know that we've talked since that.
Yeah, so it's there's options and alternatives too that people need to know about also.
Yeah.
As a senior, I find an option is go to somebody younger so that. So they're still around to take care of you in your old age.
That's an interesting, the handoff. Yeah. It's like,
I've told many of my physicians that they weren't allowed to retire until shortly after my death. So, because you want to build a relationship.
That in.
Right.
Yeah, no, I like it.
So, okay, the third one, if you're self-prescribing, and we kind of talked about that a little bit.
Oh, boy.
With the over-the-counter drugs. Judy, if you want to say anything about that.
Just to mention that many of the over-the-counter drugs were originally prescription medications like the Claritin and like some of the antacids. And the chemistry hasn't changed on those pills, but the regulations have changed, and so therefore they're over-the-counter. So just because you're taking something that you can go in and buy over-the-counter doesn't mean that it cannot... that you're not going to have any reaction to it or an adverse effect. You definitely can have adverse effects.
This is probably a really huge area that you see in your field.
It's a big area because many of us, as we get older, start taking vitamins. Even vitamins can have adverse effects. We don't do the studies on a lot of the vitamins, but I've noticed lately even the physicians are saying if you're over a certain age, you should cut your vitamin C from 1,000 milligrams back to 500 milligrams. I'm not quite sure why, because that is a calcium builder for tissue, but that may have to do with other aging things that we find out because our liver doesn't function the same way after a certain age. Our kidneys slow down. Our temperatures even change as we get older. And these are things that as non-medical, we might not be aware of.
Judy, as a part of the equation from your experience, is it safe to say that there may be a trend to overprescribe in general? Are we taking too much this is a very broad stroke question because we're talking about individuals here, but
it's a good broad stroke. Unfortunately, you're asking somebody with a bit of a bias. I think, yes, I think we do take too many drugs. I think the doctors, the last 20 years I taught and worked in orthopedics, and I think that sometimes when we deal with surgeons, they have a tendency, it's easier to write a script than to listen to a patient. I'm not saying they're all like that.
Yes.
But it does occur. And if we don't question as patients, if we don't question why are we taking this, what's going on, then we could be taking drugs that we really don't need. And I think Terry has a story to tell about that with one of her.
Yeah, I do. And that's what really kind of got me interested in all this. I was working with an older gentleman, and he had COPD, unable to breathe. Yeah. And his doctor had just given him 2 new prescriptions, and they were going to be very costly because part of my job is trying to, help keep the cost down for people. So I was looking, and these 2 new prescriptions, which were very costly, he was looking for something to help him with his blood thinner. He was looking for a different prescription to help him with that because the one he was taking was very expensive.
Right.
So that's what he was asking his doctor for. So the doctor prescribed 2 pain-killing prescriptions, opioids, that were addictive. And one I looked up because it had a different name than what I'd seen before. Yeah. And it said really big, do not take this if you have breathing problems. And this man had COPD. And these were the 2 new prescriptions that he had received. And I really could not believe it. I was like, don't take these.
So you discovered this before?
Yeah, before he filled the prescription. I said, don't fill this, because we were looking at the cost. It was going to be a huge cost. And then when I looked them up, to find out they weren't blood thinner medications, but they were pain medications. And I asked him, I go, are you in pain? And he said, no, I'm not in pain. He goes, I have a whole cabinet full of painkillers.
Yeah.
You know?
Right.
I don't need painkillers.
I don't need that.
But that's what they prescribed him, and I just could not understand. It didn't make sense to me, and Judy wasn't that surprised about it. You know, I was.
So you see this along the lines of when we see the coding errors on billing, right? Which we've had a show about.
And the other thing that's happening is that many of the hospitals now, the physicians are paid employees of hospitals. They're not in a private practice.
Yes.
And so therefore, you've got 15 minutes to see a patient, and you don't always listen.
Right.
As a physician or a caretaker, you're not
true
listening.
Active listening.
Right.
Yeah.
So that sounds to me like that's what happened here. Somebody was under the gun. They weren't listening. They looked and said, oh, well, he's taking this. Let's give him a different pain medication or whatever, and wrote it.
Right.
And this gentleman was just going to, the doctor said to do it, so he was doing it. He wasn't questioning at all.
I don't think I'm overstating that you may have saved his life.
Yeah.
Absolutely. Yeah, and that's the reason why we were discussing
that's
this.
That's an alarming
It's very scary.
Reminder.
Now, the pharmacist, if he was going to one pharmacist, that pharmacist might have picked up on it.
And you say might have. So even though they've got, software that'll say, boom, there's a red flag. I mean, does it do that? Does it actually look at different?
Yeah. And also it's how good your pharmacist is.
So they need to know how to read that.
I had that happen with me recently. The only medication I take is a thyroid, and the price went sky high for no reason at all after being on it since I was in my 20s. The pharmacist says there is a animal generic out there as opposed to a synthetic generic. And she called so I asked my doctor about it, and she said, no. Well, I actually had my pharmacist call, and when I went back in, the pharmacist says, perhaps you should look for a new doctor.
Well, the tone of that, too. No. Like,
exactly,
I know, I'm the authority, don't question me.
And I did find a new doctor, but I keep the same pharmacist because pharmacists know that's their specialty. And it's like you have to give people credit for the specialties that they're in. It's like if you're seeing a general physician, they may not have the answers for an orthopedic problem you have. So there's a reason why we have a specialist.
They are the one person where everything you're taking, and now everything you're taking, they're going to know what it is.
Even over the counter.
Over the counter.
Because they spend their whole career in studying medications. And that's why you have a degree in pharmacy. And that's and they have an internship just like doctors do. They work out when their students work out in the field. Yeah. And that helps too for knowledge.
And we don't think of them like that. At least I never did, having a relationship with my pharmacist.
I have not thought of it that way at all. This is brilliant.
This is a sidebar, but when I was teaching in orthopedics, the pharmacy school here at UNM had me come in to go over with the students how ankle supports work, how different, because when you're in a pharmacy and you may not have a lot of peripheral people. I mean, you're not in a big store like Target or Walmart.
Name your big box, right?
When you're working one of your people might come up and say, I've got an ankle and the doc said I need to get some kind of ankle support. Well, it's good for that pharmacist to know that. And I used to do that for the pharmacy school here, was to teach about over-the-counter supports, ankle supports, wrist supports, when and not where to wear them, so that the pharmacist could give an educated comment, because that's not part of their
some of this, it moves into that prescriptive area, doesn't it? Where, because they're the ones that are there, and it's the point of purchase. Absolutely. I'm making a decision. I think I need something to support this, but is it the right thing to do for the bone or my health?
That's why I speak so highly of the pharmaceutical school, because the director wanted her students to know anything that goes out of that pharmacy, so they should have a good idea of how it's used and what is done.
Yeah.
That's great. So are they still doing that?
I think they are. I'm not doing it, but I'm sure they have somebody else still doing that.
That's good to know.
Yeah.
Yeah.
Okay, so on to the next reasons why you need a medication checkup. If you just got out of the hospital, And that makes sense because you're going to have prescriptions that you didn't have before. So
the key thing with hospital, and I see this a lot too, is somebody will be in the hospital to have maybe a stint or something and they give certain medications. Often when they get called in, they'll be called in indefinitely because the doctor's waiting to see how the results are. And you may need to stop that before, or at least call and find out from your physician, do I need to continue with this? And again, you need to check those medications that they send you home with from the hospital need to be checked against what you're already taking because it's something new and different that you're adding to your
That's
arsenal.
right. Suddenly it's like it's like a shock condition to your body too.
Right,
Not only the procedure, but whatever they're going to prescribe after it.
Your physician may say, well, you stop taking this, this, and this while you're taking what I'm giving you now.
Yeah.
And if they don't give you a time, you need to take that responsibility to follow up. Because when that script runs out and you have to renew, call your physician's office. The other thing that I found works a lot if you can't get through to a physician, if you have a way, and if it means you're going down to Office Depot or one of these fax it to your doctor's office, because the doctor's offices still do fax, and it's in writing and it'll get put on the desk, whereas that phone call gets written on a big long list and the doctor may not pick up on it right away.
Okay, so to really flag it.
Yeah.
Make it a physical.
Yeah. And again, that's your responsibility to get your doctor to pay attention to what you need done for you.
Yeah, one of the key points here is that we are the patient. We need to be our own advocate. I can't say it enough times, I think.
And that's very true. And it's something that I think we all tend to get lax in.
We've gotten lax. I think we've been conditioned to be lax on some level. I don't know if you agree with that, but
yes,
over the years, just the way our approach to medicine has grown.
Yeah, we're not paying attention, right? So 5 is if you're seeing other doctors. And we already kind of talked about that.
Yeah. Again, this cross-pollination thing.
Yeah.
And it's not only that, it's with some people will go out of state or they'll go someplace for a better climate and see physicians there. So now you're not only seeing a new physician in a new area, could be a new state, but you're getting your drugs in a new state, in a new area. So you need to follow up. Not only does that new physician need to know, but you need to, again, walk in that pharmacy and say, with your list, your printed out list, I can't say enough about how important it is to have it written and printed out, or take your medications in a bag.
I kind of like that because you might miss something. You may move a decimal over on your amounts and it suddenly becomes different.
That's true. That's true. But we forget about, and we know here in New Mexico, we get the snowbirds. Well, they're usually seniors and a lot of them are on prescription medication and they'll see a physician because they're down here for 3 or 4 months.
So when they see a physician, Judy, does that physician usually ask, like, what are you currently taking? Do they ask for charts? Do they get those records?
They should be getting all of those things. But if you can take your own responsibility and get your printouts in hard copy from your physician before you go on the road, that's going to help. And again, taking your bag of medications. The more information you give a physician, the better off you're going to get in care, because they realize they're dealing with somebody who is taking responsibility. And it's much easier to treat a patient when they take responsibility.
Absolutely.
Makes sense.
Absolutely.
Okay, so our next point is if you don't need the drug anymore. And I can tell you, I see a lot of people who have baskets full of drugs, and I ask them, what is this for? And they don't know. So I always wonder, if they don't know, should they be taking this medication? That comes up a lot. I've seen that a lot.
And again, these are reasons why you need that medication checkup. You need to go in when you get your physical or your annual, you need to go in with these questions so that you can get the answers. And that's one thing. You're taking your bag of drugs in, you need to say, Doc, this is what I'm taking. What do I not need to take? What have you found out? Or will you call me after you get my lab reports and everything, and after you do a physical exam on me today, will you call and let me know what I can eliminate?
Yeah.
And that's important. Again, it's taking responsibility for what you're putting in your body.
There are these junctures, these inflection points, like the hospitalization, and as you're discharged, you have a whole bunch of new things you're taking. This situation you just described, where and I love the idea of being subtractive. What do I not need to take that's just a hangover from some previous prescription event?
Not only is it not only going to be good for your body, but it's good for your purse too.
I asked you earlier, Judy, if we're taking too many drugs, and it sounds like your honest answer was yes. In general, as a world, on the planet, do the bodies have a natural ability to balance the way ecosystems do?
I'd like to say yes, but not really. And here again, this is something we go according when my background being mainly in lab. When you get your lab results, there's a range. Well, a range is fine. And the reason why we have a range is because everybody is different as far as what normal blood sugar for you could be 80, but for Terry could be 60. And that's why we have that range. But there are also some of us that are outside that range, which is normal for us. So the same thing with drugs, yes, because our body changes. That's it. Did I answer the question?
I think so, yeah. And it was a little bit of an obscure question, but it's just something that I thought of as we're talking about.
I think that's really important. And as we age, we find our body changes. Our liver doesn't absorb fat or absorb as much water, and so we have more fat in our liver. Well, that's going to have an effect on a drug that we may be taking for the last 20 years. Maybe the drug needs to be changed, or maybe
Make an adjustment.
So as we age, and the activity alone, you could be an athlete and then all of a sudden be not a super athlete, but kind of like a normal. That's going to have an effect on those OTC vitamins that you take. And people don't think about that, especially now when we look at the balance of omega-3s to 6s. Americans don't have a good balance of that. Our balance is different than a lot of other cultures, probably because of too much fast food.
Yeah, that's powerful.
Again, that was a personal opinion, so. That's
okay. We're allowed to do that.
That was a personal opinion.
We believe in we're the hyper-free press around here, so that's.
So our last one is about if your symptoms aren't controlled.
Symptoms not controlled. Okay.
Yes.
All right, so
we'll let Judy.
Judy can contextualize that for us a bit.
Okay, that's when your doctor gives you a prescription and he starts you on a low dose. The reason why they often do that is to see how much of the symptoms you have. When you start on a new medication, hopefully your physician will say, I'm going to give you a month, or if it's a slow acting getting into the system, like a thyroid, could take 3 months. I want to see you in a month, or I want to see you in 3 months. And then we'll see where your symptoms are and what's being taken care of. Many times they can keep you on the same dosage, but other times it may not have a big effect and you're still having 2 out of the 3 symptoms you walked in with to put you on the script. So it's really important for you to be aware of those changes. And sometimes they're very subtle, but it's important to be aware of your body. And we get so busy in our lives, especially those of us who are working. I know when I was working, I didn't always pay attention I thought I was overtired because I was working so many hours.
Yeah.
Well, you could be overtired because your thyroid's off or something else is going on in your body to create that. So you have to look at everything you're doing and what's changed in your life. And perhaps your changes may be medical and not necessarily because you're overworking. So you have to look at all those.
Yeah, not lifestyle, but internal.
Exactly.
Actually, your biology is changing.
Very well put, yes.
That's so brilliant.
Yeah.
I love that.
Okay, so Judy has a list of drugs that are on the market right now that you might be taking, but you should simply not use. And if you'd like that information, you can email me, call me, get in touch with me through the podcast if you'd like a copy of that list.
Thanks, Terry. Beautiful. Judy Klymer, thank you so much for imparting your insights, your experience, your wisdom on this. It's extremely important. None of anything we've said today can be overstated. We need to be responsible as a patient for the drugs we take in the world, where our bodies are changing and the regulations are changing as well, and a whole lot of stuff is changing. So thank you for joining us.
Thank you. It was a pleasure, and hopefully I can do this again sometime.
Let's do it again for sure.
I hope so. Thanks, David.
Thanks, Terry. All right, we'll see you next time on Money Talk. Thanks for listening to Money Talk, serving individual investors and retirees. Learn more at alyxnm.com. That's ALYXNM.com.